Because you love eating candy and don't brush your teeth, a cavity appeared in your mouth. The process of repairing the cavity and how it looked afterward really amazed us. Next, let's take a look at the process of dental implant. Once you're fully laid back, the doctor will cover you with a surgical cloth, leaving your mouth exposed. But don't worry, the doctor is not going to take your life. First, the doctor will inject 2 doses of anesthetic into your gums. After that, you may feel a slight sting. The doctor will use a grinder to clean up the cavity. This cleaning process is also called dental decay cleaning. After the initial grinding, the doctor found that the decay in the tooth was quite severe, so a second, deeper grind was performed to completely remove the decayed part. Underneath the tooth, a large hole appeared. After cleaning out the decayed tooth fragments, the doctor continued to grind the decayed part at the bottom of the hole. Once the decay was fully cleaned out, the doctor covered the surface of the gums with a rubber barrier. Next comes the root canal treatment. The doctor uses a root canal tool to grind the root of the tooth into a stone-like shape. The powdered material from this grinding is cleaned with water. At this point, you can see that the root of the tooth has been beautifully shaped. After cleaning the decay and dirt from the root canal needs to be disinfected. Once the disinfection is done, the doctor uses cotton to absorb any moisture from inside. Then, composite resin is used to fill the root canal. The canal is also filled with gutta percha, and another layer of composite resin is applied. This completes the filling of the root canal area. However, it still needs to be quickly hardened using a UV light. Then, the rubber is removed, and ultrasonic cleaning is performed on the surface of the tooth. During the cleaning, the doctor discovered a small hole on the other side of the tooth and quickly cleaned that up too. After ultrasonic cleaning, the doctor will apply a layer of acidic resin to the edges of the tooth. You can see the acid resin starting to corrode the surface of the tooth, which is done to roughen the surface. After the acid treatment, the doctor applies a layer of adhesive to your tooth surface and then fills it with composite resin. The filling is done in layers, with each layer hardened before applying another. The doctor uses a larger piece of composite resin to continue filling, shaping the internal structure of the tooth. Every time a layer is added, the doctor has to shape the tooth, which tests the doctor's manual skill level. If a doctor is less skilled, they might opt for a full ceramic crown or prefabricated materials like inlays or metal. If it were you, would you choose to shape it directly with composite resin or use prefabricated materials? In this case, the cavity was carefully filled with composite resin, layer by layer. The surface of the resin is smooth, and the doctor also adds some lines to make it fit better with the original structure of the tooth, making it easier to bite into things. After completing the filling, the doctor does some final shaping and polishing. Your cavity has now been beautifully repaired. Looking at the before and after comparison, the repair of this cavity really amazed me. It looks just like a normal tooth. Now, you can happily bite into bones again. Follow for daily oral health tips. Comment yes if you want whiter teeth.